I manage a walk-in clinic in Brighton, and last Tuesday this American woman storms in clutching her ankle, demanding to see our billing department before treatment. She's insisting she needs to submit pre-authorization forms to her insurance company back in California. I explain we're NHS. There's no billing department for A&E treatment. She stares at me like I've just told her we practice medicine with leeches. "So you're telling me," she says slowly, "that you just treat people and don't charge them?" When I confirm this, she actually pulls out her phone to fact-check me on Google. After reading for 2 minutes, she looks up with this expression of absolute betrayal and announces, "This is why America leads in healthcare innovation. You people have eliminated the accountability. That comes with proper billing." She then spends 10 minutes trying to calculate what her deductible would have been at home, seemingly upset that she can't compare prices. The kicker? She leaves a 1-star Google review later, complaining about our suspicious lack of transparent pricing structures. She'd somehow convinced herself that free emergency care was evidence of inferior service, rather than, "You know how the system works? My cousin works reception at a GP surgery in Manchester, and she had this American tourist register as a temporary patient because he'd developed a persistent cough. The appointment itself goes fine. Doctor prescribes antibiotics, standard stuff. But when he gets to the pharmacy and they tell him it's £9.90 for the prescription, he completely loses it. Starts yelling that he was promised free healthcare, that this is false advertising, that he's being scammed. The pharmacist tries explaining that GP visits are free, but prescriptions have a standard charge in England, and he cuts her off shouting, "In America, we're honest about our costs up front." The irony is completely lost on him. He demands to speak to the NHS manager, apparently thinking the entire National Health Service reports to one person he can complain to. I work at a private clinic in Edinburgh, and we had this American couple come in wanting routine checkups. When I quoted them our private rates, the husband interrupts, saying they don't need private care, they'll just use the NHS since they're visiting. I explain tourists can't just walk in for free routine appointments. And his wife actually argues with me that they pay taxes in America, so they should qualify. Our tax dollars fund international healthcare agreements, she insists, which isn't remotely how any of this works. When I suggest travel insurance, the husband waves me off, saying, "We're only here 3 weeks. What could possibly happen?" 2 days later, his wife calls from an NHS hospital where she's being treated for a broken wrist after slipping on cobblestones. She's shocked they're going to bill her for the follow-up orthopedic care and keeps repeating, "But the ER was free," as if that means everything should be. I'm a receptionist at a GP surgery in Cardiff, and this American businessman tried to register with us for a 2-week business trip. When I explain the temporary patient registration process, he interrupts asking which specialist he should book with for his annual executive physical. I tell him that's not how it works here, that he'd need to see a GP first who would refer him if medically necessary, and he actually laughs at me. "So you're saying I can't choose my own doctor?" he says, pulling out his phone. "In the States, we have something called patient choice and market competition." He then proceeds to lecture me about how the American system is better because you can shop around for specialists. Try explaining that the GP referral system prevents unnecessary appointments and ensures continuity of care. But he cuts me off with this gem. That's exactly what big healthcare wants you to think. The British surrendered medical freedom the same day they implemented socialized medicine in 1948. He'd somehow researched the NHS founding date but completely misunderstood its purpose. He leaves insisting he'll just pay out of pocket to see a cardiologist directly. Then calls back 3 hours later confused why private hospitals also want a GP. Referral letter, "My brother's a pharmacist in Newcastle, and he had this American woman come in with a prescription from her GP for blood pressure medication. Standard stuff costs her the $9.90 charge. But she stands there at the counter for 5 solid minutes, examining the medication box like she's inspecting a counterfeit Rolex. Finally, she asks, "Is this the generic version or the real medication?" My brother explains it's the exact medication prescribed, just not necessarily the American brand she might recognize. She frowns and says, "But how do I know it's FDA approved?" When he points out British medications are regulated by the MHRA, not the FDA, She actually gasps. So this isn't real medicine? It's the European equivalent? She then delivers this incredible line. This explains why. British people have bad teeth, you're all taking knockoff pharmaceuticals. My brother, professionally maintaining his composure, explains that British dental health statistics are actually comparable to American ones and that medications undergo rigorous testing regardless of country. She's unconvinced and asked if she can pay extra for the American version because you get what you pay for. There is no American version. It's the same drug. But she leaves absolutely certain she's been given inferior medication because it cost under £10. I worked triage at an A&E in Birmingham, and we had this American family bring in their teenage son who'd twisted his ankle playing football in the park. Standard sprain, nothing serious. But while we're doing the examination, the father keeps asking about what insurance information we need. I explain 3 separate times that A&E treatment is free for everyone, including tourists, but he doesn't believe me. There's gotta be a catch, he insists. What about the doctor's fee? The facility fee? The imaging fee if you do an X-ray? When I repeat that it's all covered, he actually gets suspicious and asks if we're going to surprise bill him later. That's what hospitals do in America, he explains, as if we're following the same playbook. They tell you it's covered. Then 6 months later, you get a bill for $8,000.
Nice.
Wife chimes in saying they'll just wait until they're back in Houston to get it properly checked because at least there we know what we're dealing with. I try, explaining that leaving a potential fracture untreated for weeks is medically inadvisable. But the dad cuts me off. In America, we believe in transparency and personal responsibility. If there's no bill, how do you know you're getting quality care? They literally prefer the possibility of medical debt to free treatment, because the absence of a bill makes them uncomfortable. I run a health insurance brokerage in London, and we had this American expat come in asking about supplemental insurance to fill the gaps in NHS coverage. When I ask what gaps she means, she starts listing prescription coverage, specialist access, diagnostic testing, preventive care. I explain that the NHS covers all of those things, and she looks at me like I'm dense. But what about the limits? She presses. You know, annual maximums, lifetime caps, out-of-pocket expenses. She'd brought a whole spreadsheet, comparing American insurance plans, and was trying to apply those metrics to the NHS. When I explained there aren't annual maximums, because the NHS isn't insurance-based, she actually argues with me. Every healthcare system has limits, she insists. That's basic economics. She then shares this theory. The NHS must be hiding the real costs through taxation, which means British people are paying more but don't realize it because it's not itemized. She'd somehow calculated that the average British person pays more in health-related taxes than Americans pay in insurance premiums, which might be technically true until you factor in American deductibles, co-pays, out-of network charges, and medical bankruptcy. But she's absolutely convinced she's uncovered some conspiracy where the British government is overcharging its citizens. I suggest she might want private insurance for shorter wait times on elective procedures, and she jumps on this, see? That proves the NHS doesn't work if it did. There'd be no market for private insurance. The concept that people might want faster access to non-urgent care without believing the public system is broken doesn't compute for her. My sister works as a nurse at a teaching hospital in Leeds, and she had this American patient who'd been admitted for appendicitis surgery. After the operation goes smoothly and he's recovering well, he asks her for an itemized bill. She explains he won't receive a bill because NHS hospital care is free for residents, and he's been living in Leeds on a work visa for 8 months. He actually argues that he wants the bill anyway for his records. She tries to explain there isn't a bill to provide. He gets agitated and insists there has to be a cost breakdown somewhere for the surgery, the anesthesia, the hospital stay, the meals. My sister, trying to be helpful, mentions he could request his medical records, which would show what treatments he received. But that's not the same as an itemized cost statement. He then delivers this absolute gem. How am I supposed to know if I'm being overcharged if you won't tell me the prices? She gently reminds him he's not being charged at all. And he replies, "That's what worries min business. When something's free, you're the product." He'd somehow applied tech industry skepticism to emergency surgery. Before discharge, he actually asks to speak to the hospital's chief financial officer to understand the pricing structure and seems genuinely disturbed when told patients don't interface with hospital finance departments. I'm a medical secretary in a private practice in Bristol, and we had this American woman book a consultation after her NHS GP wouldn't refer her to a dermatologist for cosmetic Botox. She's absolutely furious about this and spends the first 10 minutes of our appointment ranting about how her GP blocked her access to a specialist. I gently explain that NHS GPs don't refer for cosmetic procedures because they're not medically necessary, and she erupts. Not medically necessary? I have wrinkles. That's definitely medical. When I point out that cosmetic treatments are available privately, which is why she's in our private clinic right now, she complains about having to pay out of pocket for something she considers healthcare. In America, she announces, if you have insurance and want to see a specialist, you can see a specialist. The government doesn't get to decide what's medical and what's cosmetic. I resist pointing out that in America, insurance companies absolutely make those determinations and rarely cover Botox for wrinkles either. She then asks if she can report her NHS GP for refusing treatment, and seems shocked when I explain GPs are doing their jobs correctly by not referring cosmetic cases to NHS specialists. This is exactly what happens with socialized medicine, she concludes. Bureaucrats decide what you're allowed to care about. She pays our private consultation fee, but leaves a scathing online review about how the NHS forced her to go private for necessary medical care. I work at a pharmacy in Oxford, and we had this American graduate student come in with her first NHS prescription. When I tell her it's $9.90, she pulls out her American insurance card and slides it across the counter like we're at a hotel check-in. I explain we don't process American insurance here, and she looks confused. But I have international coverage, she insists, pointing to a tiny globe icon on her card. It says worldwide coverage right there. Clarify that worldwide coverage might mean her US insurer reimburses her for foreign expenses, but she'd need to pay up front and file a claim later. She's visibly annoyed and asks, "So what's the point of insurance if I have to pay anyway?" Then she notices the prescription price again and actually says, "Wait, did you say $9.90? Like $9.90? When I confirm, her whole demeanor changes. "Oh, that's fine then," she says, almost disappointed. "I thought you meant pounds sterling." I point out, it is pounds sterling, which is actually more than $9, and she just stares at the medication. "But my copay in America is $35 for generic medications," she mumbles, seemingly trying to reconcile why the British system is cheaper. After paying, she asks if prescriptions are always this cheap, and when I mention some people get them free with exemptions, she actually looks offended on behalf of herself. "So I'm paying for medication that other people get free? That doesn't seem fair." The concept of means tested healthcare apparently conflicts with her sense of equal treatment. My flatmate's a practice nurse at a clinic in Liverpool, and she had this American patient come in for a routine blood test his GP had ordered. Everything goes smoothly until he asks when he'll receive the bill. She explains there's no charge for NHS blood tests ordered by your GP, and he immediately gets suspicious. "What about the lab fees?" he asks. "The processing fees?" "The doctor's interpretation fees." She keeps saying there are no separate fees, it's all covered, but he's convinced there's hidden costs somewhere. Finally, he says, "Look, I know how this works. You say it's free now. Then in 3 months, I get a collections notice for £2,000. She tries, reassuring him that genuinely won't happen. And he responds with this, "That's what they told me at an urgent care in Texas. And I ended up paying $1,200 for an ear infection." His entire framework for understanding healthcare is based on surprise billing, and he literally cannot process the concept of a blood test that costs him nothing. Before leaving, he asks for her full name and employee number just in case, and mentions he'll be monitoring his bank account closely for unexpected charges. She never hears from him again, presumably because no mystery bills ever materialize. But he never comes back for follow-up appointments either, because he's probably still waiting for the other shoe to drop. I'm a GP in Southampton. I had this American patient demand a referral to the Mayo Clinic for a second opinion on his high cholesterol diagnosis. Not a private UK consultant, not an NHS specialist, specifically the Mayo Clinic in Minnesota. When I explained that's not how NHS referrals work, and that it would require international private healthcare at enormous expense, he actually argues with me. But I've been paying national insurance contributions for 2 years, he says, as if that entitles him to fly to America on the NHS dime. I know my rights as a taxpayer. I try to clarify that national insurance doesn't work like a health savings account you can spend internationally. And he cuts me off. So you're telling me I'm trapped in the British healthcare system with no access to American medicine? The word trapped is doing a lot of work there. He then informs me that American doctors are more qualified on average. It's because of market incentives and that he needs a real expert, not someone who works for the government. I resist pointing out that I attended Cambridge Medical School and trained for a decade, instead suggesting he's welcome to seek private care if he's unsatisfied with NHS treatment. His response, private care means I admit the NHS failed, and then they win. I'm genuinely not sure who they are in this scenario or what they're winning. But he leaves, insisting he'll figure out a way to get Mayo Clinic access covered by the system I'm paying into. I later hear from the practice manager that he's filed a formal express complaint claiming I refused him appropriate specialist care. My daughter works as a translator at a hospital in Nottingham, and she told me about this American woman who came in after a minor car accident. Nothing serious, just needed checking over. But she refuses to provide her passport or identification because she's convinced the NHS is going to share her information with US insurance companies to raise her premiums back home, staff tries explaining. That's not how any of this works. That NHS patient data isn't sold to American insurers, but she's adamant. I've read about data breaches, she insists. Healthcare information is valuable. She'd somehow conflated legitimate concerns about data privacy with this fantasy that the NHS actively sells patient information internationally. When they explain they need identification to verify she qualifies for NHS treatment as a visitor, she argues she should be treated regardless because healthcare is a human right. Which is true. Emergency care is provided to everyone, but administrative paperwork still exists. She eventually provides her passport, but makes the staff sign a handwritten document. She's drafted on her phone, promising not to contact American insurance providers. The staff signs it to move things along, even though it has no legal standing whatsoever, and they wouldn't be contacting American insurers anyway. Before leaving, she asks if British hospitals also report to credit bureaus, because apparently she's convinced her minor A&E's visit will somehow affect her credit score in Florida. I work at a dental surgery in Glasgow, and we had this American family registered for NHS dental care after moving here for work. They're confused when we explain there are patient charges for NHS dental treatment, the father saying, "Wait, I thought healthcare was free here." I clarify that medical care is largely free at point of use, but dentistry, optometry, and prescriptions have charges in England, though dental care in Scotland has somewhat different rules. This sends them into a tailspin of trying to understand why dental care isn't considered healthcare. In America, dental insurance is separate from medical insurance, the mother explains, as if teaching me something. But I assumed Britain would be more advanced than that. When I provide the fee schedule showing the 3-band system checkups, fillings, and more complex treatments, they ask why it's not just a flat monthly premium like insurance. I explain the NHS doesn't work on a premium system. You pay when you receive treatment, and they find this somehow more confusing than the American insurance model. The father then asks, "So what happens if I just don't get dental work done? Do you send it to collections?" I mention that no, you simply wouldn't receive dental treatment if you didn't pay, and he seizes on this. See, that's why the market system is more efficient. You pay up front, you know what you're getting. He'd somehow arrived at the conclusion that fee-for-service dentistry proves capitalism's superiority. Despite the NHS dental charges being a fraction of American private dental costs, I'm a paramedic in Sheffield. And we responded to a call where this American woman had fainted at a shopping center. Standard vasovagal episode, nothing serious, but she's absolutely panicking about the ambulance bill. While we're checking her vitals, she keeps asking if she can refuse transport to hospital to avoid charges. We assure her that NHS ambulances don't bill patients, and she literally doesn't believe us. I fainted once in Chicago, she explains, and the ambulance alone was $2,000.